Hello. Okay, I think.
Hi, Vera. We are waiting for everyone to join and we'll start in a couple of minutes.
Perfect.
Hello, everyone, and thanks for joining us. We'll start I'll give it another minute and then we'll start. Okay, so before I start, I just want to mention that this event is being recorded. It's also being broadcasted live on Facebook as well. Ladies and gentlemen, welcome to our today's discussion titled The COVID-19 Battle During the Toughest Sanctions Against Iran. My name is Bijan Ahmadi and I'm with the executive team of the CIC Toronto branch. Wherever you are, I hope you and your family and loved ones are safe and healthy. Before I introduce our panelists, allow me to explain the format. We'll have around 30 to 40 minutes of initial discussion with our panelists, and then I'll ask some of your questions. To send in your questions, please use the Q&A feature that is available on Zoom. The Canadian International Council, CIC, is a platform for citizens to engage in discussions on international issues. The mission of the CIC as an independent, nonpartisan, and charitable organization is to involve citizens in defining Canada's place in the world. The CIC is a membership-based organization. Different chapters nationwide organize multiple events and panel discussions such as this on a regular basis. If you would like to know more about the organization, or if you would like to join the CIC as a member, please visit thecic.org. Iran is among the hardest hit countries in the Middle East by the coronavirus crisis. According to the Johns Hopkins Coronavirus Resource Center, as of today, there are over 112,000 confirmed cases of COVID-19 in Iran, and nearly 6,800 people have lost their lives. Iran is also one of the few countries dealing with this level of cases while living under severe economic sanctions. After Trump's withdrawal from the Iran nuclear agreement, the JCPOA, his administration has imposed severe economic sanctions against Iran. President Trump himself explained that Iran sanctions, in quote, are the strongest sanctions ever put on a country. In recent weeks, world leaders, US lawmakers, Joe Biden, civil society organizations, and hundreds of academics worldwide have called on the US administration to ease economic sanctions on Iran, at least for the duration of the coronavirus crisis. But the Trump administration has only ramped up its maximum pressure campaign, even during the COVID crisis. Today, we have Negar Mortazavi and Vera Ameli to talk about the COVID pandemic in Iran and also discuss the impact of sanctions on Iran's health sector and its ability to combat the pandemic. Negar Mortazavi is an Iranian-American journalist and media analyst based in Washington, D.C. She has been covering Iran and the wider Middle East, as well as US foreign policy towards the region for over a decade. She frequently appears as a guest commentator on BBC, MSNBC, NPR, and Al Jazeera, among other outlets. In 2017, she was named a Young Leader by Friends of Europe in Brussels, Belgium. The Guardian has named her one among the top 10 people to follow on Twitter for Iran news. So don't forget that, please. Vera Ameli is a PhD candidate at the Center for Evidence-Based Intervention at University of Oxford. Her research examines access and adherence to treatment for people living with HIV in Iran and the larger Middle East and North Africa. She's leading a research project for which she has secured funding and built international collaborations across University of Oxford, Tehran University of Medical Sciences, Harvard Medical School, and Boston University School of Public Health. First, let me start with you, Vera. You published an article recently titled Sanctions and Sickness. In the article, you provide an overview of Iran's response to the pandemic since February, when the first case was officially confirmed in Iran, and explain the obstacles it has encountered in its response. Could you please give us your expert assessment of Iran's response to the pandemic so far?
Sorry. Thank you very much for having me and for that very nice introduction. So Iran's response has to really, as the title of this panel suggests, be considered in light of the situation that it's under, and that is the onslaught of sanctions that it has been imposed by the US since 2 years ago, almost. And so while the first case of coronavirus in Iran was confirmed on the 17th of February, it is a known fact that cases were probably prevalent both in Qom and Tehran already by the 19th of February, when the first case was confirmed. But according to all health officials that I've spoken to in Iran, the testing kits for coronavirus had only arrived on the 17th, so 2 days before the first cases were confirmed. And by then it was already a bit too late to take an approach like you could have taken maybe in a South Korean way, in that you immediately start case finding and contact tracing. From an operational perspective, Iranian health system has human resources, and it's very efficiently built to have that kind of response. But unfortunately, because they couldn't secure access to testing kits early enough, the pandemic had already gained its momentum. So by that point, for example, quarantining Qom would have been unnecessary, because 2 days after, confirmed cases and deaths were seen in Tehran, Arak, and Gilan. So the pandemic was really across many of the central and northern cities. However, what Iran did do and didn't do is, they were actually quite quick in terms of closing down schools and universities. So in Qom and Tehran, schools and universities were closed. Schools especially were closed the day after the first announcement. 2 days after was the elections, and that should have, in hindsight, probably been canceled, and that may have led to the outbreak sort of gaining a larger size early on. But then again, this happened in many other countries. France and the US also had elections and didn't cancel it 3 weeks after the first cases were confirmed. So it's important to take these considerations in mind. And once Iran secured access to testing kits, as I mentioned, it was already a bit too late. So you know, Iran became one of the epicenters in the Middle East. But after that, and because initially there was concerns in the Rouhani administration to close down the economy that was just recovering only barely from stagnation. Because of that, the weaknesses were coming from the economic pressures that the country was experiencing. So in a way, you can say that the approach that Iran took was similar to a Swedish approach, in that it was very pragmatic. So it's not that the government didn't do anything. They closed down schools immediately, eventually closed down universities across the country, but they took longer to close down the economy, especially given that it was a month before Nowruz, Iranian New Year, and we all know that that's the most economically productive month of the year for many Iranians. I would say that after that, though, there was an efficient health system response, which obviously also included many sacrifices. But then again, sanctions had impacts there because initially, early on in the pandemic, it wasn't easy to get access to personal protective equipment and all the necessary means to protect health workers. So early on, there was more losses of lives among health workers as well. But the hard work paid off in the sense that it flattened the curve to the extent that we didn't see a situation like Italy or Spain, where we were out of hospital beds or extremely out of ventilators. And then slowly, with civil society mobilization, sort of pooling capital together, pooling resources together, that curve started to get flatter and flatter, and the government eventually imposed a lockdown as well, which helped slow down the pandemic.
So let me ask you, Negar, Vito talked about the impact of sanctions, touched on this topic. You have written extensively about the impact of sanctions on humanitarian trade with Iran. But in response to calls for lifting the sanctions, the US State Department responds that there are humanitarian exemptions in the sanctions regime against Iran. So considering these exemptions, could you please explain for us then what is the impact of sanctions on Iran's COVID response?
Well, there are humanitarian exemptions. We have to be clear on certain trade with Iran. That does exist. So U.S. officials are not wrong to claim that. And also we have to remember that food and medicine are generally exempt from U.S. sanctions. But under the conditions of coronavirus, the COVID-19 pandemic, it's not medicine that Iran needs, as Vera was mentioning. It's medical equipment, it's medical supplies, it's personal protective equipment, it's gloves, it's sanitizers, it's masks, it's all of these equipments that are not necessarily drugs and medicine that are automatically exempt from U.S. sanctions. And there are certain lists published by the U.S. Department of Treasury, and where people can go and see how certain medical equipment are actually not exempted and basically banned from being sent to Iran. That's one part of the one layer of the problem, that certain equipment are generally just not exempt from sanctions. And when it comes to humanitarian trade, on paper, basically, the law of the sanctions does exempt this kind of trade with Iran, even when it comes to issues like drugs and food, medicine, basically. But in reality, when you look at the actual trade, the lack of this trade happening, we understand that financial and banking sanctions, basically these other large aspect of sanctions, is what's affecting humanitarian trade as well. Because humanitarian trade, at the end of the day, you need to be able to purchase and move a commodity into the country as a form of trade. And banks and certain companies, especially in Europe and some even in Asia, are not willing to take that risk. Even though humanitarian trade with Iran is exempt, they're not willing to take that risk to open accounts for Iran when it comes to the financial transaction, or for companies to engage in any kind of trade with Iran, in fear of repercussions from the US government, from the Treasury Department, that's been very aggressively going around after countries who do any form of trade with Iran. And it's just, at the end of the day, it's not the kind of trade that's worth it. Because if you look at, for example, European companies, they have this big market, which is the United States, the world's largest economy, and then they have this fairly smaller market, which is Iran. If business with Iran is going to jeopardize their business with the US, their access to the US market, it's a very easy a simple choice that these companies make, and not want to be punished or worse, put on secondary sanctions list by the United States. So it's not only the actual humanitarian trade, but it's also financial and banking sanctions that limit that. And we saw the effects of that under the COVID-19 pandemic, as Vera was explaining, on test kits. There were problems with buying test kits with Iran that the World Health Organization had to step in and actually deliver these test kits. There are some NGOs like Relief International and others who are delivering equipment and test kits to Iran to basically bypass what sanctions have been preventing from getting into the country. And even some of those non-governmental organizations who are supposed to be exempted in this kind of trade have had trouble and some roadblocks in trying to bring the equipment into Iran. So this definitely had an impact, which is a fairly unique one, is that Iran is only one of the very few countries in the world that's dealing with this extra layer of sanctions under this global pandemic.
Vera, Negar talked about the obstacle that the sanctions have created. But if we want to get to the specifics of which part of the health sector is being impacted, what equipment, what medication is in need that the sanctions are not allowing to get in, because it's a fact, and you actually touch on this in your article as well, that Iran is self-sufficient in terms of most medication that it needs. Now, sanctions harm the overall economy. Negar mentioned how it is actually blocking financial transactions. But could you please tell us specifically how sanctions impact Iran's access to medications, specific medications that they need, both before the corona crisis and also after that? Because I don't think it's an issue that was created just by the pandemic.
Yes, absolutely. As Negar mentioned, the issue is really that despite the sort of on paper exemption for humanitarian trade, because the financial trade is in place, and because there are issues in terms of transport, there is a transport block basically on Iran. Specifically with regards to the coronavirus pandemic, the transport block was intensified as neighboring countries also closed their borders. So that's also one of the reasons why the World Health Organization faced delays in delivering the testing kits that it wanted to Iran. But the financial transaction sanctions have been in place, since before the pandemic, and we have seen rare medications that are needed for rare diseases that Iran doesn't produce, sort of not being imported to Iran. The Swedish company Mölnlycke that delivers bandages for a rare genetic disorder that causes skin lesions in children to the point that the infections can lead to death, sort of stopped delivering these to Iran in December. And because of it, 15 children lost their lives. And the Swedish company basically just stopped trading with Iran because of fear of secondary sanctions from the US. On the other hand, when we say that Iran produces 97%, up to 97% of medications for its own needs, it's also important to keep in mind that complete self-sufficiency doesn't really exist anywhere in the world. Even if you want to produce medication in your own country, you have to import raw material and the basic ingredients that are oftentimes not produced in Iran. So for example, even if you don't have the needed capsules for a certain pill, you won't, the whole production will halt and you won't be able to make those, make that medication. So this type of blockade and not being able to deliver those raw materials and basic ingredients have affected cancer patients and many patients with rare diseases. And also when there is a time, when there are times that there is more medication or, for example, a vaccine needed, in a certain period of time, a disease becomes more prevalent, the ability to import these needed medicines is slowed down. For example, just before the coronavirus pandemic, there was a flu outbreak in Iran that this year was particularly deadly and killed up to 100 people in about a month. And that's because Iran ran out of the vaccines that it had produced, and it wasn't able to import more vaccines. And so there was, then a black market was created immediately, and people couldn't access flu vaccines. And this is similar to what happened initially with the coronavirus pandemic, that when you can't import needed medications in a timely way, then the momentum that these, especially infectious diseases, gain is so rapid that it can overwhelm your health system later on.
Nigar, now Europeans have asked US to lift at least some of their sanctions during the coronavirus crisis. Also European countries, some of them Switzerland and the European Union, they have tried to establish humanitarian trade channels with Iran. Are these channels operational right now?
Yes, as you said, European governments, US as basically closest allies, namely the United Kingdom, we know behind the scenes have been asking the US administration, the Trump administration, to ease some of the sanctions. And I just want to mention that there's precedence for that, both Democratic and Republican. Under President Obama in 2012, there was an earthquake that hit the northwestern area of Azerbaijan in Iran. It was a devastating earthquake, and President Obama eased some sanctions and provided channels for humanitarian aid to get into Iran for a certain amount of time, 45 days if I remember. And then in 2003, when the massive earthquake hit the city of Bam in Iran under President Bush, there was also an easing of sanctions and certain humanitarian channels open, and even the US provided aid. For the first time since the revolution, there was American aid and American personnel airlifted in Iran after that earthquake. So there's Republican and Democratic precedents for this, but the Trump administration has decided to not take that route. I even want to mention that the Prime Minister of Pakistan has pleaded directly to President Trump on Twitter to ease sanctions on Iran. Also, the UN Secretary General and also the Human Rights Commissioner, the High Commissioner for Human Rights in UN, has asked the US to ease sanctions on Iran and other countries, but that the Trump administration hasn't acted on that. Moving on to the channels, the humanitarian channels, one of them, this vehicle created by EU countries called INSTEX, which is basically a way for European countries to bypass US sanctions, because initially when President Trump pulled out of the Iran nuclear deal, the European countries were opposed to that. They asked him to not pull out. He did eventually, and he imposed these sanctions. And Europeans, Iran and US's European allies came out strong against those sanctions, and they vowed that they're going to create a channel to basically bypass them and continue this trade with Iran. It took almost 2 years for that channel to operationalize. And then under this pandemic, end of March, it had its first transaction. So it's a great first step, but it's only been a first step, and it's only been one time so far. So it's something that politically the Europeans were behind, and it was very promising. But when it came to reality, again, we have to remember that their main economic partner is the United States, and the US administration is going aggressively against any kind of trade and business with Iran, and that has affected Europeans. There's also another channel I have to mention, which is through the Swiss. It's something that the Americans helped facilitate in response to a lot of calls for easing of humanitarian channels. So basically the Trump administration in a way acknowledged that humanitarian channel wasn't easy, and they helped create this channel through the Swiss government to facilitate. But there's so many conditions and limitations that that channel has also had one successful transaction so far. So there's these two channels that exist on paper, but as far as in reality, they've been hard and very slow to use. And it's definitely not something that relative to Iran's need, the population, the speed of this pandemic, and the amount of actual supplies that they need, these two channels haven't been enough in basically responding to the needs on the ground.
So I'd like to remind everyone, if you have questions, please use the Q&A feature on Zoom to send in your questions. For the last 20 minutes, I'll take questions from the ones that you've submitted. We already have a couple of questions submitted, but please send in your questions, and not in the chat box, but using the Q&A feature on Zoom. Vera, now let's talk about the current situation in Iran. Iran has lifted at least some of its lockdown restrictions already. According to reports, certain parts of the country are experiencing a rise in the number of infections again. Do you think Iran is going to face a second wave of infections? And if yes, do they have the capacity in the healthcare system to manage a second wave?
Yes, as we've seen in the previous weeks, Iran has slowly opened up its economy in terms of the low-risk businesses, but we are seeing that there is a rise of cases in some parts of the country. And in fact, this week, the government has implemented a lockdown again in Abadan and certain parts of the country that are seeing a rise in the number of infections. It's epidemiologically speaking, I think that it's expected that there will be a second wave everywhere. We are seeing this even in South Korea right now and Germany. And the scale of it also depends on how seriously people take this pandemic in terms of the precautionary measures that they take. I think in the field of public health, we're always trying to change people's behavior, but it's very difficult to sort of have people wear masks for months on and, not hug each other and implement these behaviors on a, on a prolonged time period. So I think that recently we see that Iranians are also risking taking, you can now call it risky behavior by, shaking hands or things like this. So it will depend also on that. But in terms of Iran's ability to deal with this second wave, it will depend on the scale of the pandemic, of the sort of rise in infections. The real issue is also that because of the economic pressure that Iran is under, economic resources are currently scarce. And so Iran can't give the same sort of protections that you would expect UK and US give to their populations, even though they're not even doing enough here. But I think it's important here to mention that oftentimes when we talk about the scarcity of economic resources in Iran, we are seeing that the US sanctions have caused a contraction of Iranian economy by 14%. But then the Western media narrative of this issue is to blame corruption and mismanagement. Yes, there is corruption within the Iranian system, as there is in many countries around the world. However, the nature of corruption is different in many developing countries to developed world. And I just want to make this point that the way that these narratives in the media condemn Iranian mismanagement and corruption is very colonial, and it basically sees the type of overt and unsophisticated ways of corruption that happens, not just in Iran again, but in many developing countries. And then, but to compare that to the amount of tax evasion and multinational corporations basically stealing resources that belong to the public for their private use. There's great academic work on that shows that it's not even comparable. So to say that sanctions are not the main cause and corruption is just a flawed argument, especially when you consider that corruption has always existed in Iran, but it's since sanctions have been imposed that we see this contraction in the economy, which is affecting the ability of the government to give economic benefits to prolong the lockdowns.
And I think one point that you mentioned in your article as well is that sanctions actually lead to more corruption as well. And I think we are going to actually share the link to your article in the chat box as well for our attendees that want to
Just to
read
clarify
that.
one thing is that sanctions leading to corruption, again, it's not to say that it's equivalent to the amount that we are seeing in terms of the contraction of the economy. Sanctions lead to certain behaviors in all countries that are facing scarce resources, that certain goods are then are hoarded and then sold in the black market, for example. These types of behaviors are normal, but to sort of use that narrative as a justification that, oh, so then the economic problems that Iran is facing is because of corruption alone, that just, the numbers don't add up. And I think that if there wants to be an argument, a real argument made on that, there needs to be an academic evidence-based calculation that shows that the numbers add up and that makes sense. But currently there isn't anything like that. It's just a media narrative to justify sanctions.
Okay, Negar, let me actually shift our discussion a bit and talk about Iran-US tensions. Do you think COVID-19 will pressure Iran and US towards diplomatic negotiations or actually towards further tensions and conflict? Do you see any opening for diplomacy between Iran and US, especially before the upcoming US presidential election?
Well, there have been so many calls for this opening, and basically this being an opportunity for an opening for humanitarian gestures on both sides, and basically this being a result of the political fight between Tehran and Washington, the result of this fight making the pandemic even worse for ordinary Iranians. It doesn't seem like the Trump administration has been deciding to reduce any of this maximum pressure policy, but there's one area where both sides seem to be making some progress, and that's prisoner swap. As we know, there are some American and dual national prisoners in Iran on espionage charges, on various security charges, as they call it, which they've all denied. And on the US side, there are some Iranians either held by the US or by the order of the United States and other countries for evading US sanctions against Iran, for trying to sell or trade or import or whatever material that are banned under US sanctions. And there has been some talks and some suggestions on both sides by diplomats, by officials, that both sides claim that they're ready for prisoner swap. There has been one successful prisoner swap done under the Trump administration between an American academic from Princeton University and an Iranian academic who was held here in the US. Both were freed, and there have been calls for more to be done. We haven't seen that happen yet. The Iranian side, the Iranian foreign minister, other diplomats have said that they're ready to do these talks for prisoner swaps unconditionally, and the US, there's been some blame game going, but it seems like there might be some opening in that area, and hopefully that can be a window into further engagement. But as far as major policy changes, we haven't seen it much from the Trump administration. It seems like they're adamant in putting this maximum pressure on Iran, thinking that this would bring results, which it hasn't in the past 2 years. And also in Tehran, I don't think there is going to be much of a policy change before the US election. There's only a few months left of Trump's presidency, and Tehran has decided to follow what they call the policy of maximum resistance under maximum pressure. So I see this maximum pressure and maximum resistance simultaneously continuing in the next few months, except for maybe that opening for prisoner swap, which is a good humanitarian gesture on both sides, and hopefully it will happen for some of the prisoners to get out. Especially, also we have to remember, because of the conditions in prisons under coronavirus, one of the Iranian prisoners here in the US actually contracted COVID-19 in custody of ICE, and there's fear that some in Iran might be contracting COVID-19 too in prison.
Vera, it is usually ignored in the media coverage, but we hear that the civil society in Iran has mobilized greatly to help the healthcare system in fighting the pandemic. You talk about this in your paper. You mentioned it in one of your answers to the first questions as well. Could you please elaborate on the role the civil society has played in Iran in the fight against COVID-19?
Yes, absolutely. I think that one of the resources that we have really in Iran is our human resources, and the solidarity that we see in the society. Sometimes it's really inspiring. Some of it may come from the fact that as Iranians, you know, we are you know, for better or for worse, we don't have the full level of trust in our governments that people in Western countries may have, to just expect, you know, everything to happen by the government. So when there is an earthquake, when there is any sort of humanitarian crisis, Iranians mobilize very efficiently. Sometimes it has to be said that this mistrust in the government is not a very good, it doesn't lead to a good outcome because resources aren't pooled together, but usually the mobilization does help a lot with humanitarian crisis. In response to the COVID-19 crisis, we saw civil society mobilization, not just in you know, parts of the society where there is a lot of capital, but also the more, you know, middle class volunteers that came together, social workers that came together and tried to help in the response, but also in the private sector. People across different classes, different, you know, religious commitment levels, all did come together and pooled resources. Even some Iranian diaspora, they collected capital, even though there was difficulty in terms of transfer. But Iranians had to, you know, come up with creative means to then bring all these resources together and use it in the country. In the case of ventilators, for example, this campaign of a private sector for public good campaign was able to source ventilators from different private clinics spread across the country and use them and give them to the hospitals that were most affected by coronavirus. So this type of mobilization really did help, and I hope that it will continue to move on, and there will be a central sort of force in pooling all the resources together.
Negar, Iran has recently requested, this will be my last question and then I'll go through audience's questions. Iran has recently requested a $5 billion loan from the IMF. This is the first time in decades that Iran has made such a request. US and supporters of sanctions say that Iran doesn't need this money. Their argument is that Iran must use its internal resources and funds that are in possession of entities such as the Office of the Iranian Supreme Leader, Ali Khamenei. What's your assessment of this argument? Is Iran using these internal resources, and if it's not using it, why?
Well, as it was mentioned, we can't overlook the issue of corruption and misuse of funds and mismanagement in Iran. There's certain resources and funds available in the country, but that's a domestic, or I would say an internal discussion that's going on. There are a lot of critics of the government, of the administration, of the entire system, within the system, the civil society outside of the system, and that domestic discussion is going on. But the issue of sanctions, basically, these are not mutually exclusive. Sanctions is just adding a layer to the already problematic situation in Iran. And even if one nurse was deprived of a mask or a pair of gloves, even if one health worker contracted COVID-19 or died of it because of the issue of sanctions, this makes it not just a practical issue, but also a moral question. What is the moral standing of these sanctions when it comes to this problem, regardless of whatever internal problems Iran has? And they do, and there's a lot. And then also, to add another layer to this, the Iranian government is now facing the highest budget deficit of its history. About 50%, the gap is going to be this budget deficit because of this of these crippling sanctions that are affecting almost all major parts of the economy. Add to that the coronavirus, the pandemic, which is a major economic burden, and also the declining price of oil, which is the main commodity that Iran sells to the world, that's also been impacted by sanctions. So these major problems have made the Iranian economy shrink to the point that the government is facing this huge budget deficit, and it's going to be very difficult to keep people under lockdowns or do full quarantines when you don't have the money to feed people, basically telling them to stay home and not go to work, not make money, and survive this economic problem. And when it comes to the issue of the loan from IMF, I want to also add this, that there's been a massive campaign by the US, but on the other hand, even here in Washington, there's disagreements on this. We've had senators, we've had members of Congress from the Democratic side calling on the administration to let this loan be given to Iran because of the massive need that the country has, as well as European partners, and of course, some Asian governments and leaders asking for this loan to be given to Iran, but then also to have a monitoring system and oversight to make sure that this loan, this money is being spent in areas where it's said it's going to be spent to deal with the economic crisis and with the issue of the pandemic. But unfortunately, the Trump administration is turning this also into a political issue, and they've suggested that they're going to block the loan.
Okay, thanks. So let me go through the questions from audience. First, I'll ask this question. I'll pose this question to you, Vera. I'll read two questions because I think they're relatively similar. Does credit for relatively low number of deaths go to the medical system independent of the state, or does the state also deserve credit? And there is a second question, which I will read as well. To what degree did the regime focus on concealment of numbers of deaths rather than reducing them? So both of them have to do with the basically the response of the state versus the healthcare sector.
Great questions. So I believe that the lowering of deaths is, I mean, you can't really separate the two. Again, when you think globally, the US has an excellent healthcare system in terms of the quality of its healthcare workers, the training that they receive, and you know, the quality of medical services in the US are impeccable. However, there is no access to healthcare for a large proportion of the population. Whereas in Iran, you have a system where it has a very strong health system, but also it has, since the institution of the, or since the revolution really, even during the 8 years of war with Iraq, Iran has focused on building an efficient primary healthcare model that reaches not only the very rich and the urban population, but also everyone in the rural communities. So this efficiency of the Iranian healthcare system has undoubtedly helped during the pandemic. And this is, and also the fact that the government subsidizes healthcare costs. It does try to provide universal access to healthcare. In fact, if it wasn't for sanctions, the Rouhani administration had implemented universal health insurance for everyone in the country, but they had to stop that program and roll it back. But right now, 90% of the costs of healthcare are covered by the government. And many of the best hospitals in Iran are state hospitals, like Imam Khomeini hospitals, that is the teaching hospital of Tehran University. So to separate the two is impossible, because yes, we have great healthcare workers, but there is the infrastructure to have them, like there is the medical education and the infrastructure to provide health. All of this goes hand in hand with state policies and public spending in Iran. I have to add that when you compare Iran to other countries that have good relationships with the US, you see that their health systems and the amount of public spending that they can spend on education and health is very limited because of the IMF loans and the social restructuring policies that is enforced on many countries around the world. So when we talk about corruption, we have to think about the amount of public spending that already exists in Iran on health and education is more than most other countries that have benefited from good relationships with the US. And in terms of the concealment of numbers versus reducing deaths, I think that the two are not really connected. I don't think that there is a deliberate, or I don't think that so far there's evidence for deliberate attempt by the Iranian Ministry of Health to conceal numbers. But the fact that the numbers reported are lower than the actual deaths due to coronavirus is an issue globally. It's a chaos of numbers that we're living in, and the numbers that are reported are the ones that are tested for COVID. So, you know, initially there was maybe more of a discrepancy because there were less tests and they weren't used for postpartum cases. However, now it's you know, catching up. And I don't think that it's fair to say that there is any more of a discrepancy between the actual numbers and the reported numbers in Iran as compared to the UK, to France, to the US, to any country in the world, really.
Negar, let me read two questions for you. So this talk on COVID-19 in relation to sanctions for Iran seems to focus very heavily on Iran-US relations. What are the thoughts from both speakers on the significance or lack thereof of relations to other countries across the globe? Is the USA so effective in its efforts that the efforts of any other country are not making a significant impact to Iran at this time? And also, let me actually read the second question, which is regarding regional relationships of Iran as well. It said, how has COVID-19 impacted the regional relationships of Iran overall across the region? With Iraqi and Lebanese protests occurring before the pandemic, what will the implications on these movements once restrictions are lifted and normalcy comes back? Sorry, I'm reading exactly as the questions are submitted, so I hope it was clear.
So when it comes to other countries, it's interesting that some other countries stepped in to basically help deliver these needed equipment to Iran and bypass this wall of sanctions. China, of course, Iran's one of the biggest trade partners, especially under the shadow of US sanctions, stepped in to donate, and then also to deliver some much needed equipment. I also want to mention that the initial arrival of the virus to Iran, which seems to be coming from China, also has a sanctions angle, because China has been one of Iran's lifelines under the sanctions, and economic trade and even political relations with China have been very sensitive and very strong when Iran is stuck basically behind this wall of sanctions, and China has been the economic power that's helping Iran bypass US sanctions. So that also played a role in basically sustaining these travel and trade with China that helped spread the virus into Iran very quickly at the beginning. When it comes to other countries, even if some European countries have stepped in, European NGOs have stepped in to deliver goods and material to Iran. European Union has dedicated some major funds, millions of dollars, to equipment being delivered into Iran. And some of Iran's regional neighbors, who are not considered close allies, some are even foes, especially under the Trump administration's policy, like the United Arab Emirates and Kuwait, Iran's two close neighbors in the Persian Gulf region. They've also stepped in to help in this time of basically humanitarian crisis. The United Arab Emirates facilitated some aid through the World Health Organization. Their airlines have been used, and also Kuwait gave a few $1 million of aid to Iran. And it's not just the issue of regional cooperation, it's also a matter of Iran being the epicenter in the Middle East. And if it stays like that, if the virus is not contained, it would easily spread to the entire region, to its neighbors. And as Vera said, Iran has one of the best health systems in the region compared to some other countries that are basically war-torn, with not much left of a health system to begin with. And if the virus makes its way into those countries and becomes a pandemic, it will be devastating for everyone in the region. So I think that understanding from some of Iran's neighbors, including rivals, has been very important. And then also the international community stepping in. But still, the power of the US economy and the power of US sanctions and basically the aggressive manner in which the administration is going after any form of trade and relations with Iran has impacted all of this, even in this humanitarian crisis.
Vera, another question. Can we calculate and quantify the loss of life from sanctions? And the question continues that this will shy off some sanctions supporters claiming to defend human rights. The second question is, clearly the sanctions against Iran are extreme and wide-ranging, which explains the immediate lack of PPE, personal protective equipment. Other heavily sanctioned nations, such as Cuba, find ways to acquire medical resources through purchasing partnerships with other countries. How does Iran make efforts to acquire needed PPE or other resources from countries not involved in the sanctions?
In terms of calculating deaths caused by sanctions, I think that would be, a great undertaking. But it's very, it's not easy to, it's not a straightforward calculation. But the fact of the matter is that when an economy of a country contracts, it leads to poverty, and poverty leads to death. I mean, this is just, the case everywhere. When you have a pandemic like the COVID-19 crisis, this cycle is magnified, because not only you're going to have people dying of COVID-19, but you're also going to have more people dying of poverty, more people losing their incomes, and then the economy further contracting, leading again to further poverty, and so on. So it's very difficult to, have a clear calculation. But if effort is put into it, I think it is possible to sort of look at the excess number of deaths. For example, in the case of Venezuela, there is a report now showing that there is an excess number of 40,000 deaths within the past year since the institution of Trump's sanctions on the country. But again, I think it's important to consider that sanctions are not leading directly to death, but they're really slowing down the development of a country. What I mentioned earlier was structural adjustments of other countries that receive loans or support from the US and then are encouraged to increase private spending and marketization instead of having public spending. Iran cannot continue with its public spending and continue development if it's under sanctions. And when its development is halted, then it undoubtedly would lead to more illness and death. So I think on a more theoretical ground, it's important to keep this cycle in mind, and not think of a direct sort of a direct relationship, because there are multiple layers. And in terms of PPE, from what I know, Iran has been trying to produce PPE itself. And even though initially it faced problems, but currently the situation on the PPE front is much better. In terms of testing kits, it was able to produce testing kits with European sort of licensing level of approval that it even exported some. Questionable whether it would have been better to hoard like some other countries do. But then again, I think that some of the positive impacts of pressure is that you try to develop yourself despite limited resources. And I hope that Iran would do more of that than trying to rely on other countries.
And on the PPE, I just would like to add that I think early on, China also sent a significant number of PPE deliveries to Iran as well. Question for Negar, and this might be the last question we will be able to cover. Given Iran's unprecedented budget deficit, could it be argued that the maximum pressure campaign has been, in fact, effective in terms of putting immense pressure on Iran? And do you think Iran is going to be forced to negotiate with the US if President Trump gets reelected in November? This situation seems to not be sustainable in long term.
Well, I want to also combine this with another question, which is referencing that the sanctions by the US are basically the fault of the Iranian regime. And this goes back to the political fight between Tehran and Washington. And, you know, both sides have a long list of grievances against each other. The US pulled out of the nuclear deal while Iran was abiding on all of that. But what I want to focus on is that the US administration continuously says that this maximum pressure campaign is aimed at the Iranian regime, at the Iranian government, at the IRGC, and not at the Iranian people. But what we're seeing in reality is that the ones that are actually paying the price of these sanctions, of the maximum pressure, of the crippling of the economy, are ordinary Iranians, are middle class, working class Iranians who, whether it comes to their access to healthcare, their access to food sometimes, their access to certain specialized medicine, as I would discuss, to PPEs, to test kits when it comes under coronavirus, at certain periods of time, it's basically limiting their access to these essentials. And it's an issue of human rights when we look at it from that moral standing, that this policy is basically infringing upon the rights of certain parts of the Iranian population. There was also a question about human rights and sanctions. I think it was an excellent question that, yes, there are human rights activists that talk about human rights violations by the Iranian government in Iran, but sanctions also are a form of violation of human rights of ordinary Iranians, who some of them don't have any say in this political fight between Tehran and Washington, but they're the ones who are actually paying the price for it. And as far as the maximum pressure policy working, if the goal is to pressure the Iranian population, is to crush the economy in a way that the Iranian middle class and working class will pay the price for it, yes, it's working. But as far as changing Iran's behavior in the region, changing Iran's policies domestically, changing Iran's policies towards Washington, it hasn't changed any of that. In fact, if you talk to experts, Iran has become even more aggressive in the region, and tensions are high between the two countries and some of their allies, and it's just become more dangerous for everyone, especially under the circumstances of this pandemic.
Okay, thank you so much for your time, Negar and Vera. Thanks for being with us today. Thank you to all the attendees who participated and listened to this discussion. I tried to ask as many questions as possible, especially I was looking at the votes, because you can vote on the questions that we get on Zoom, and I tried to ask first the questions that were voted by other participants that they want to hear about them from the panelists. This video will be available on the Facebook page of the Canadian International Council, so if you would like to share it with your network, please go ahead and find it on the Facebook page of Canadian International Council. It will be on YouTube as well. Again, thank you so much. For next events, please check the website of the CIC. It is the cic.org. Thank you and have a good day.
Thank you for having us, and thanks everyone for participating.